Hello, this is Dr. Gay from First Look MRI, and this is a 60-year-old female who complains of finger pain and limited range of motion. We have an x-ray on the right-hand side here. We see the bone. This is the distal phalanx of the fifth finger, the pinky finger. This is the middle phalanx. This is the proximal phalanx, and we're looking at the finger in profile. On an x-ray, we call this a lateral view when you're looking at something in profile. On the MRI over here on the left, this is called a sagittal view. It's the same orientation, but it's called a sagittal, looking at the finger in profile. And of note here in the x-ray, we see that there is this bone density over the back of the knuckle. So I'm going to zoom that on up here. So you can see this bone density here. This is in the region of an extensor tendon. The flexor tendon will make the finger flex down. It comes off here. Proximally, you can see it on this MRI. Here's a flexor tendon. It's a thick tendon. And when this contracts, the finger will curl down towards the palm. And there's also an extensor tendon, but it is more complex. And the extensor tendon has a central slip that comes up in the middle, and then it has a couple lateral bands that come around the side and attach over here. So this distal attachment, this little dark part here, the lateral bands come together to attach here. And the central slip comes up here, and it will attach right here on the base of the middle phalanx. So kind of a complex anatomy to the extensor tendon. And here the extensor tendon should come up, and it should attach right here in the base of this bone. But we know there must be a problem with that because all this calcification or ossification in the soft tissues. You can see the knuckle looks like it's prominent here. And now to look at this anatomy a little bit better, we're going to put up another projection. This is called a T2 fat set or proton density fat set sequence. And on this view, we can see things a little bit better. We see the central slip, which is this band here. This is part of the extensor tendon, the middle component. And it's going to come up here. It should come really straight, hug the bone, but instead it is lax, it's elevated, and it ends about right here. And remember, it should attach to the base of the middle phalanx. So it's torn from the attachment and pulled back a couple millimeters here, and it's lax, and it's elevated, and beneath that we see this brightness. This is some fluid or inflammation underneath. And again, those other components go around the outside, and they come over here to the distal phalanx. So this is a torn or ruptured central slip from the insertion, and there's also ossification here, which don't see very well on the MRI, but this will require surgery. This is an axial image, slicing a short axis, and this is the central slip. And we see central slip here. We see it there. And in this cat, we lose it. So there's where we see it, absence. This is a torn central slip. You see these lateral bands. Here's one, and they will come together distally and attach to the distal phalanx. So lateral bands are intact, but the central slip is torn from the insertion. It is also reactive marrow edema. You can see how bone is nice and dark down here, which is normal, and here it's bright, which means that there is edema. Thank you very much.